All right, good afternoon everybody. I know that you will all want to know about the traveller from New South Wales, so I'll keep the vaccine part of this briefing very brief at the beginning. I do want to acknowledge that we did hit a very significant milestone. 1 million doses of the Pfizer vaccine have now been delivered in New Zealand. That includes 637,847 first doses and 381,517 second doses. District Health Board's tracking 7.5% ahead of plan. Last night I was advised by the Director General of a person who recently returned to Sydney from Wellington and that they had tested positive for Covid-19. The information that we have to date suggests that the case in question was likely to have been infected before they travelled to New Zealand and that the case is linked to the current Sydney cluster. I'll hand over to Dr. Bloomfield shortly for a detailed update on the case and the case details, locations of interest and contact tracing. But first, I do want to reassure New Zealanders that we've always had plans in place for situations like this, and that is what we are working through now. Our contact tracers are currently working at pace, and they have been since we were first notified of this case last night. The positive case, who is back in Sydney, was spoken to last night and again early this morning. The person's 4 close contacts were notified last night. They were put into self-isolation and they were tested first thing this morning. 2 results so far have come back from those tests. Both of those have been negative. Locations of interest were identified and published before 9 a.m. this morning, and they've been updated as more information has come to light as part of the investigation process. We're continuing to work very closely with the case and with the case's close context here in New Zealand to ensure that we have the information that we need for our own swift response. We've taken a very deliberate and cautious approach to pausing travel when there is community transmission in states in Australia. That cautious approach continues. Where cases can't be linked to the border or there are unanswered questions about their origin, we do impose a pause. So last night we made the decision to pause quarantine-free travel with New South Wales before we'd been notified of this most recent positive case, based on the information that we had to hand at the time about the current investigations around the outbreak in New South Wales. The pause came into effect at 11:59 p.m. last night. It will remain in place for 72 hours and it is under constant review. When the positive case left Sydney, at the beginning of the weekend, there were just 4 cases, all with clear epidemiological links to the border. That number has since grown significantly. Today, ministers have been looking at further measures to reduce the possibility of transmission here in New Zealand. Even though we have no positive cases at the moment, we do know that we had a positive case and that person had some extensive potential exposure in the Wellington region. We just held a special cabinet meeting and out of an abundance of caution, the Wellington region will move to alert level 2 from 6 p.m. tonight, and that will run through at this point until 11:59 p.m. on Sunday. The rest of New Zealand will remain at alert level 1. For the purposes of this announcement, the Wellington region includes the Wairarapa and the Kapiti coast up to north of Otaki. Cabinet will review this again on Sunday. A reminder about what Alert Level 2 means. It means that there are limits on gathering size. Gatherings in the Wellington region are limited to fewer than 100 people. We know that gatherings do pose the biggest risk, and that includes weddings, birthdays, funerals, tangi, church services, and so on. Social distancing should be observed in public places. In retail stores, supermarkets and clothes shops, there should be 2 metres of social distancing. And at least 1 metre in most other places, such as workplaces, cafes, restaurants and gyms. The wearing of face masks remains compulsory on all public transport, but we're encouraging people to please also wear these when waiting for public transport and in taxis and rideshare services as well. We'd also encourage people to wear face coverings in any situation where they are interacting with people that they do not know and social distancing is not possible. Businesses can open but must follow public health rules, including ensuring physical distancing, record keeping, and the cap on the number of people at 100. Schools and early childhood services stay open at alert level 2. Hospitality venues can remain open, but they need to apply the 3 S's: seated, separated, single server. If you're sick, please stay home, don't go to work or to school, and don't socialise with others. If you have symptoms of cold or flu, aches and pains, please call your doctor or healthline and ask about getting tested for COVID-19. Please keep track of where you have been at all times. This case is a very good reminder of our need to use the COVID-19 Tracer app and maintain an accurate record of your movements. People who were at locations of interest, who scanned in using the QR codes, will have been notified of those exposure events. While travel is not restricted under Alert Level 2, please remember to take the behaviours with you if you have been in the Wellington region over the weekend. For example, if you were in Wellington and you're now in Christchurch, please don't attend large gatherings. This will help to keep us all safe. This is the first time we have moved up to Alert Level 2 to manage the potential risk of COVID-19 in the community. This is not a lockdown. If we can all contribute and follow the health behaviours that I've outlined at Alert Level 2, we can break a potential chain of transmission. I want to reiterate that these are precautionary measures which will remain in place while we contact trace and test everybody that we need to. First and foremost, we want to ensure that New Zealanders are not unnecessarily exposed to COVID-19. So I'll now hand over to Dr. Bloomfield and then we'll open up for questions.
Thank you, Minister. Kia ora koutou katoa. So just a little more information about the visitor from Sydney who spent the weekend in Wellington, and then some detail around the public health response which swung into action last evening as soon as we were notified by our counterparts in Australia about this positive case who was identified in Sydney once they had travelled back there. So what we know so far is that based on the timeline of symptom onset and the CT value of the test, it is most likely that the virus was contracted in Sydney prior to the visit to New Zealand. Now, I would say we've learned this morning also that this person works in a healthcare setting that is very near the Bondi Junction, which is the focus of the outbreak in Sydney at the moment, and that one of the cases that is part of the current outbreak in Sydney had been seen in that healthcare setting. So there's a very strong epidemiological link, and we fully expect the whole genome sequencing results that are due back later today to confirm that this new case, the person who travelled here, is indeed part of that known outbreak in Sydney. The person has had the first dose of a COVID-19 vaccine. We know that, and that was about 10 weeks ago. Now, the case used the New Zealand COVID Tracer app frequently during their visit here, which is excellent, as did one of the other people who's a close contact and was with them most of the weekend. With their permission, we have already downloaded the data and we have started the process of sending out notifications. And of course, that was also allowed us to corroborate the information that the person provided on recall about where they had been and the times they had been there. Of course, our hope is that many people who visited those venues that are places of interest had also been using the app, and if so, they will receive a notification. However, that is complementary to the information that we now have on our website and that we have put out in media releases about the places of interest, the locations of interest. We now feel we've identified, based on the current information, all the locations of interest. There will be some more specific detail about one or two specific venues within Wellington Airport that we will provide when CCTV footage has been reviewed, but otherwise all the known places of interest are now public. It's a good reminder of the value of the app, and I can't encourage people enough, wherever you are in New Zealand, at any time, to use the app to keep a record of where you've been. At this stage, there are 4 close contacts, 2 of whom are located in Palmerston North and 2 in Tauranga. All 4 have been isolating since last night. The 2 who are in Palmerston North have tested negative, and we're awaiting the results on the 2 in Tauranga. However, what I would say is that the 2 people in Tauranga had a much more fleeting interaction with the case, a much shorter period of time with them. We're expecting those results back soon. The contact tracing team is also in the process of contacting 58 passengers who were on the flight that came into Wellington last Saturday morning, very early in the morning from Sydney, and they are working through the people on that flight. Many of those people will have been notified, they'll have all been notified last night and will be ringing Healthline directly, so we will be able to make sure we get in touch with all those people. Now, those people on that flight are considered close contacts, all of them, which means they are required to do the full 14 days in isolation and do the usual day 5 and day 12 testing. Just on the locations of interest, as I said, those have now all been published. So please, I encourage Wellingtonians and those who were in Wellington over the weekend to check that list and to see if they were at any of those places of interest at that time. If in doubt, to isolate and ring Healthline to get further advice if they were in any of those places. As a minimum, they will be required to be tested and remain isolated until they have returned a negative test. Some will be asked to isolate for the full 14-day period, and Healthline will be able to advise you on that. So we know the person stayed at the Ridges Hotel in Featherston Street, spent the weekend visiting various tourist and other places around Wellington and dining in the central city. They left Monday morning at 10:13 a.m. Most of the people on that flight will be followed up by our Australian colleagues. Some will have returned to New Zealand, and we're getting the information to make sure we can follow those people up as well. In terms of testing sites, here in central Wellington, the community testing station at 200 Taranaki Street is open, and extra capacity will be being brought on board there. Likewise, there is a testing site in the Hutt Valley. From mid-afternoon, there will be a further community testing centre at the ASB Indoor Stadium in Kilburnie, and most GPs and many urgent care centres will also do testing. So please check with Healthline. When you talk to Healthline, they will be able to let you know the closest place to get tested. I should say that whilst we have those 2 close contacts in Palmerston North, again, both have tested negative initially, there are no locations of interest or any particularly increased risk in Palmerston North or in Tauranga at this point in time. Finally, on wastewater testing, ESR will be carrying out additional wastewater testing today from samples taken yesterday at the Moa Point site, and we should have results of that tomorrow. And the other numbers from today, there are 4 new cases in managed isolation, and there were around 5,900 tests undertaken yesterday. And yesterday there were around 470,000 scans with the app. We need and want that number to increase, and I encourage people everywhere around the Motu to use the app to scan, because you never know when you might need that information. Thank you, Minister.
Just before I open up for questions, to foreshadow a couple of the questions I know that will come up, the Cabinet has also made the decision that government MPs and ministers will not be participating in large gatherings over 100 people anywhere in the country while this restriction remains in place in Wellington. Most government MPs and ministers have been in Wellington during this period of time and are in Wellington during this alert level change, and therefore we will take that with us wherever we go around the country. Parliament, I have spoken to the Speaker, Parliament will continue to sit today, but will be sitting under alert level 2 conditions. Jessica.
So, Minister, given the high number of places that have high numbers of people at them, why does this not meet the threshold to go into lockdown?
Ultimately, this is a very cautious approach that we are taking by moving up to alert level 2. Yes, there are exposure settings, but we will be leaning heavily on our contact tracing systems to make sure that we can ring fence any potential cases that may flow from that. We will be monitoring that closely over the period between now and Sunday. If we do see cases, and if those cases are people who we have identified and had and asked to be tested because they were in those exposure places, that will be encouraging information. If we start seeing additional cases coming up that we haven't identified through our contact tracing, that's the sort of environment in which we would reconsider whether any further changes might be required.
I'll
let you finish that and then I'll come to Tova.
that first tranche of locations of interest came out just before 9 o'clock. Most of those people will have gone to work taking public transport. Are you concerned that that wasn't put out earlier?
Look, it was put out as soon as it was available, as soon as we were able to assemble that information. Obviously, in situations like this, time is of the essence. This is one of the reasons that we are escalating alert levels to alert level 2. There are people out and about in Wellington and potentially around the country who will have been at those exposure settings over the weekend. Tyler.
Being so sluggish to release those locations, you exposed more people to risk, didn't you?
Oh, look, I don't think it would be fair to characterise that as sluggish. We first became aware of this case, I think at about 8:30ish, around about 8:30, 8:45 last night. Bearing in mind that there is a night time in between then, the contact tracers were working into the evening and again early this morning to put that information together.
The person had also used the COVID app, so surely putting up those locations of interest could have been at least done before 9 a.m.
Could I comment, Minister? So, just recalling, first of all, this person is back in Sydney, and the case is an Australian case. They notified us during the evening and provided some information. The first thing our teams did here was identify the 4 close contacts, and they were identified, spoken with, and were put in isolation and to be tested this morning. Once the Australian authorities had finished talking to the actual case, our team here, or Regional Public Health, spoke to them into the early hours of the morning, so to get as much information as possible. First thing this morning, our team, we did put out the media release just after 6 around the fact of the case, and then the teams looked at all the information about the places of interest. And there is a process that needs to be gone through by our experts to assess what the risk is, to determine what it is we are going to ask people to do who have been in those settings, and that was done as quickly as possible this morning. The first tranche was put out just before 9, and then the further list was put out around 11:30.
Jane?
So should the person have been on the flight in the first place, were they at any locations of interest in the Bondi outbreak or in the red zone? Do you have any concerns at all around them being part of the Trans-Tasman bubble?
So if I reflect back to last Friday and the number of cases, as the Minister said, at that point we had 4 cases. The locations of interest were already, if people had been at locations of interest, named locations of interest, they weren't allowed to travel to New Zealand. That's true. The place where this person works and where subsequently there has been a case linked to, was not identified as a place of interest at that point in time, and the case who we've had here, who was diagnosed yesterday, was not considered to be at risk.
What is the timeline then between the place that the person worked and the person, another case, having visited, and them being in New Zealand? Was there any point at which they realised that they had been closely connected? And again, is there any concern at all that this person either was unaware or breached the rules of the bubble?
There's no information we have to suggest that, but obviously we'll be working with our Australian counterparts. What I can say is that the place where it appears the infection has occurred was not listed as a location of interest. So there was no particular reason why this person couldn't travel to New Zealand.
Minister, why didn't you pause the bubble sooner?
Up until yesterday, all of the cases that they were identifying in New South Wales were linked. It was the emergence of cases yesterday where there was not a clear link that prompted the pause in the bubble.
Be more cautious though with the bubble. If there is a community case, do we just hit pause?
Look, we are very cautious, but ultimately, as I've indicated before, alert level escalation or pausing the Trans-Tasman bubble, we do consider a similar range of factors when we make those decisions. We don't want to do that unnecessarily. And where there are cases that are coming up, where they are linked, where there are people who are in isolation, that doesn't necessarily prompt an alert level escalation or a pause in the bubble. What we saw yesterday was we saw at least 2 cases where there were some big question marks over them. There was no immediate apparent link, and that's what prompted the discussion around the pause.
When it comes to Wellington City, it really is a village. There's sort of 1 or 2 degrees of separation, including to you guys. Have we ended up putting, is it more problematic that we've got a case in Wellington, especially in terms of access to you too?
Look, I think ultimately a case anywhere in the country is challenging. Ministers, the Director General, the people who work on this travel around the country frequently as well, and we do everything we can to avoid there being cases here. We've put in place now measures around this building that we'll be moving to alert level 2 around this building as well, that will make sure that those who are leading the COVID-19 response have an extra layer of protection around them, as we're putting in place for everybody who's in the Wellington region.
With the Trans-Tasman bubble, when it was put in place, lots of people were nervous about it, but you promised that if there were concerns, you'd hit pause and that we would be protected. Can you understand how people will be feeling frustrated with this?
Look, I think there will from time to time be cases of COVID-19 that pop up either in Australia or in New Zealand. That's the nature of COVID-19. What's really important is how quickly we respond to those. The New South Wales authorities responded very quickly to the cases that popped up late last week. The further cases that were being identified were all linked cases. They were people who were isolating because they were a linked case. It was when we started to see evidence that the COVID may be spreading outside of that circle, that contained circle. That's when we made the move to put the pause in place.
The was last week when that first emerged, the person wouldn't have been able to come to Wellington over the weekend. So can you see in those situations you do have to act quickly? You can't give it breathing time?
Well, I think one of the challenges here, and again we were pretty open about this when we started the Trans-Tasman bubble, if we were to react every time there was a case associated with the border, the Trans-Tasman bubble potentially would be closed more than it is open. So we have to actually make sure we've got good systems in place. Where there are cases linked to the border, the key is speedy response, contain them without the need for additional measures. You use additional measures where there's evidence that they've spread further.
Has the visit to the chemist been interrogated a bit more carefully in terms of why they were there, and are you confident that the symptoms only became evident to this person on Monday and not any earlier?
In terms of the first question, I don't have any more detail. There's quite a long period at the pharmacy here in Wellington, but we do allow a margin either side, so it doesn't mean that the person was in the chemist for all that period of time.
What they were buying there, were they in there, for example, for a cold and flu tablet? Is that something that you're looking at?
What I can say is, and this goes to the second part of your question, is the person became aware of symptom onset quite clearly in their mind at about 3 o'clock in the morning on Monday. Was the first onset of symptoms, which is sort of some head cold type symptoms.
Can you say what time health officials became aware of the New Zealand locations of interest? Because the Jack Hackett's bar had a football event on with 50 people at 7 o'clock this morning. Could that have been avoided?
So the locations of interest information was gleaned by the contact tracing team at Regional Public Health when they interviewed the person late last evening and into the early hours of the morning. Then that information was again reviewed when the teams, both from Regional Public Health and our Director of Public Health and other members of our incident management team sat down and looked at it first thing this morning, and then it was released as soon as we were confident we had the places, the times and the expectations of people all lined up, and that was when the information was released.
At 7 o'clock this morning that Jack Hackett's was a place of interest, and could you have avoided the
Yes, I didn't personally know, but the team at Regional Public Health had elicited that information, but you will understand that there is then a process of looking at that information to assess what the risk is. For example, how long the person was there for. Some locations that the person may have visited don't become a location of interest because we don't feel there's any risk at all. So there is a process that has to be gone through.
So how did the case travel around? Is there any indication that they used taxis or public transport? Because we have no information on how they got to the airport. Was it all private vehicles at this point?
Look, I don't know, but if there's a specific conveyance, like an Uber or a taxi or a shuttle perhaps from the hotel identified, and there was no one else in it, then that doesn't become a place of interest. We simply follow up directly with the company to find out who the driver was, and then that person becomes a contact and has to be treated as accordingly.
On close contacts, what is the current guidance for close contacts of close contacts? So people, obviously there's a lot of people who would have been at the papa or would have been at Pick-on-Pie or various places over the weekend. They would have gone to work on Monday and possibly this morning because the information would have come out until a bit later. A lot of people would have been around them. what should those people do? Anything?
So the advice is on the website, and that is for people who are in those locations of interest. The advice is what to do there. We're not necessarily encouraging people who have come in contact with people who are close or casual contacts to do anything at the moment, except, of course, do what all Wellingtonians will be doing, and that is abide by the level 2 provisions. And whilst that comes into place formally at 6 o'clock, I would encourage people to start taking note of them right from now.
Amelia.
But in these cases, why not actually go hard and go early? If you knew that the Jack Hackett's bar has been identified as a location of interest, why not send out an alert through the COVID Tracer app first thing in the morning and say, everyone who's there, isolate until we have more information, and play it that way? And why are you waiting for CCTV footage from the airport? Why not say, everyone who is at the airport during this time, stay home until we know otherwise?
Well, it's a matter of getting the balance right, and I have confidence in our team here and in Regional Public Health in their assessments of the risk, and they will be taking a number of things into account. I think they did a good job this morning of getting that information together, and if you look, I think as we've gone through our various cases and outbreaks here in New Zealand, we have got faster and faster at getting these locations of interest out, and you'll see this time real clarity about what is expected of people without any confusion around definitions of whether people are close or some other sort of contact.
Yeah.
Minister, does this show the vaccine rollout is too slow? Does it give you any encouragement to speed up the vaccine rollout?
Look, the vaccine rollout is going as fast as possible. To put some numbers on that, it took us 48 days to reach 100,000 doses, 14 days to reach 200,000 doses, then 28 days to reach 500,000 doses, and 33 days to hit 1 million doses. What that shows is that this is a vaccine campaign that is ramping up quite rapidly. The biggest constraint up until this point, and probably up until 2 weeks from now, is supply. It's having enough vaccine doses in the country. We are expecting to get some bigger deliveries of the vaccine from mid-July onwards, which we've canvassed before. But I also want to bear in mind that DHBs are running 7.5% ahead of plan. They are moving as quickly as they can, given the supply constraints. I'll let you follow that up.
There's some questions around the timeline about when you found out, when you made decisions, when you communicated them. Can you tell us when the advice was provided on closing the bubble, when the government decided to close the bubble, and when you decided to communicate that? And in addition, when you were informed of the positive case and when you decided to say that?
So we started having conversations about the bubble and about a travel pause with New South Wales mid to late afternoon yesterday. The Director General and I spoke from memory somewhere around about 5 o'clock and made the decision at that point. I consulted with a couple of other ministers and we made the decision at that point to do the preparations, to get the order in place and to kick off the process for pausing the bubble. Then I think it was around 8:30, 8:45, the Director General sent me a text message saying that there was information about a case. I called him, I think, within about 90 seconds of that, and then we obviously kicked into gear with our response phase.
Had communicated the travel pause?
I'm not sure exactly what time the statement around the travel pause went out. I don't have that information with me, sorry.
Is the Prime Minister's trip to Australia still going ahead?
No decisions have been made on that at this point.
Are you looking to increase vaccination in Wellington as part of a contingency to safeguard any infection here?
That's not something we've considered at this point.
Why not? Sorry, why not? Why not?
Look, at this point, the vaccine rollout will continue. One of the things we have to bear in mind, though, is that if we wanted to ramp up the vaccination program in Wellington at the same time as also ramping up testing in Wellington, which we're also going to be doing, that's the same workforce. So we wanted to keep the vaccination program on track. We're not proposing at this point to scale it back in other places in order to increase dose allocation for Wellington. Joe.
Can you just confirm, will the Dawn Raids apology have to be cancelled this weekend?
Actually, and I've just had confirmation of that has come through that we will not be proceeding with that at this point. It will be rescheduled. So further advice on a new date and time and arrangements for that will be communicated in due course.
Can I also just ask, please, in terms of the casual plus and close plus contacts, they were still being used when the first lot of locations of interest went out this morning. There's also businesses who have put out information about them being involved as locations of interest before the statements have gone out to the public. These lessons were meant to have been learned. Why is this stuff still happening?
I'll ask the Director General to comment on the casual plus and casual contact distinction. One of the things that I would note, though, is around locations of interest. We're trying to do multiple things simultaneously. We're talking about a matter of within a few hours, if not minutes. And so sometimes people will hear things through different communication channels. Speed is of the essence. And so it is a little bit patchy, but we get information out as quickly as we possibly can. But I'll ask the Director General.
Two comments there. On the definitions, the casual plus casual and close definitions. Yes, the first tranche of places of interest that went up this morning, that was included in there. Those are what we use internally with our discussions with public health units, because there's a common language there and about what the actions will be. Once we saw that up, I said to I worked with the team, I talked to them and said, actually, I think what we decided and had agreed was the main information people needed was, here is the place and time of interest, and here's what you need to do. So we're now not necessarily providing those categories. And in terms of I think your second question was around businesses who put information out before it went up officially. We do try hard, and one of the things if possible, we like to talk to those businesses and notify them before it becomes public. Some of them may then choose to put a message out, either through social media or to call staff. Of course, that could always happen, and I think that's fine and appropriate, but our preference is to notify businesses or places of interest before the information becomes public.
We'll come over here.
Bloomfield, just two quick questions. First of all, the Jack Hackett's pub on Saturday, the Super Rugby final was on Saturday night. Do we know how many people were in the pub? Was that sort of chocker full?
I don't know how many people were there, but I imagine it was a crowded venue, and we do know that the risk factors are these places where it's crowded, close contact, and so that would be a venue, and that's again one of the key reasons why these sorts of venues with these sorts of circumstances is one of the key reasons that lay behind our recommendation to ministers to move Wellington to alert level 2.
We'll come down the front.
Just to clarify, just on locations of interest, are open air locations included in that? For example, if they went for a stroll up Mountain Vic Lookout, would that be recorded?
No, that wouldn't be included as a place of interest, because we know the risk is much, much lower in those outdoor places, especially knowing what the weather was like in Wellington over the weekend. I doubt there were many other people up at the top of Mount.
Yes. On the vaccine rollout, are you considering delaying second shots at all so you can get more first shots in arms?
That's not something we've considered at this point.
Quickly also, are you aware of any other country where they've imposed restrictions without a single case being present in the country?
Well, again, I'd say that while the case isn't currently in the country, they were in the country. So the fact that they have left doesn't mean that the exposure events are any less than had they been staying in a hotel room for the last couple of days, for example. Jane, I'll come back to you.
Does this reveal a vulnerability in terms of rapid testing, either on departure from Australia or on arrival in New Zealand?
No, I don't think so. I mean, ultimately, our systems are put in place based on the levels of risk that exist. We did introduce a pre-departure test from Melbourne when there was a reason to do that. Things moved quite quickly around New South Wales, so we've put a pause in place, but pre-departure testing may be one of the off-ramps that we use when we come out of the other side of that. We can consider that all of the time. We consider that, and we impose those restrictions where there's a good public health rationale to do that.
Logistically, is it difficult to do that in the operation of a bubble? Is that why you wouldn't do it? Because it would obviously put another measure of precaution. Is that the reason that you wouldn't do it?
It's possible, but it is a big undertaking, so we would do it where there's a public health reason for doing it.
The Auditor General's just said it'll be a huge challenge to get up to 70,000 doses a day. Are you still confident that every Kiwi will be offered a vaccination booking by the end of the year?
Yes, I am confident that Kiwis will have the opportunity to have a vaccine by the end of the year. We got up to, I think we're just shy, I think it was getting up even close to the sort of 20, well, it was 25, we might have even been getting close to 30,000, I think, at one point. So the team are ready to ramp up. When the supplies come in, they'll be ready to go.
Is your peak 70,000 or 50,000?
It's a 50,000 on average, but that does mean that on some days it'll be more than 50,000, on other days it'll be less. So at the moment, we've been doing 100,000 a week, but that hasn't been evenly spread throughout the week. So we see, slower uptake in the weekends. We tend to peak generally by around Friday. Friday's often one of the best days of the week.
On the vaccination, have you got updated numbers on how many people we vaccinated, first dose and second dose for each specific group? Because last week, lots of group 2 still hadn't been vaccinated.
Yes, we do have updated numbers in the report we will have received today, and I don't have them with me, but we can make those available subsequently.
Obviously, this person used the COVID tracer app, but that may not be the case for everyone coming from Australia. What information do people coming from Australia get about using the COVID tracer app, and should there be a rule in place where you can't leave the airport unless you've got it downloaded on your phone?
Well, we've certainly considered the latter, remembering that it's not compulsory to have the app in New Zealand. No one's required to have the app, but we have got around 2/3 of our adult population who do have the app. That's excellent, and it's, from my reading, one of the highest in the world. People are given information about the need to and the value of downloading the app when they come. Most importantly, they are required to provide contact information of where they will be when they're in New Zealand and how they can be contacted, email and phone information on the No Maira database. I should say it's equally important for all New Zealanders to have the app and use the app, and in fact in this case that will be even more important than the fact that the person did use the app very regularly while here.
Just coming back to Henry's question, I'll give you the first dose numbers, and the information around second doses and so on is also available. But 54,829 people in Group 1 have had their first dose. Group 2, it's 362,000. Group 3, it's just over 177,000. And Group 4, it's people who are being vaccinated out of cycle for whatever reason, about 43,500.
Group 2 have not been vaccinated then, because that was supposed to be 500k or so, and it was supposed to be done in 3 months. Those are people who they might be in rest homes, that work in rest homes, might be healthcare workers. Shouldn't that be done by now?
One of the things that I've also mentioned before is across groups 1, 2 and 3 there will be some overlap. So some of the people in Group 2 may have been vaccinated but counted under Group 3. So there's a bit of unevenness in those numbers. Tova.
Of the speed at which those locations of interest went up. Are you saying that there is no way you could have got those locations up any faster?
Look, I haven't had a chance to go back and review all of that yet. We obviously do. Every time there is an event like this, we go back and review whether things could have moved more quickly or whether there are other things that we could learn and do differently next time. But the teams I know are moving as quickly as they can. They have been working through the night to get this information together.
Were the people interviewed last night though?
My understanding is, yes, they were interviewed last night and this morning.
Why does it, just from an outside perspective, and granted we don't understand what happens behind the scenes, but that just seems like a really long time to get that note up?
Well, just to say, I mean, the interview process is quite lengthy and it gleans in a lot of information, and the process then is, first of all, to corroborate that information, including because the person gave permission for the information to be downloaded from their app, and then to assess the risk of each of those locations, to determine, in fact, whether they need to be made public as a location of interest, and then to, as I said earlier, our preferences, of course, is to notify those locations, especially if there's going to be quite a significant impact on them before that information is made public. Again, if you look, we were notified. I found out about this around 10 to 8 last evening, and within a pretty short space of time, we had not only been able to interview the person in Australia after the Australian authorities had done that, but we had isolated the close contacts here last night, 2 of whom have returned negative tests, and get all that information out before midday on those locations of interest with clear instructions to people about what to do.
Okay, we'll go Anna, Mark, then Amelia.
Do you have any more information on the positive COVID case this person came into contact with in a healthcare capacity in Sydney? Because there are significant testing orders in place there. Did they know about that case in the first place? Or should they have even travelled to New Zealand?
Yes, I don't have any further information. I've shared the information I have that the person works in a primary healthcare setting. We've subsequently found out that one of the cases amongst the outbreak in Sydney had been seen at that healthcare setting last week, and that suggests the epidemiological link. But there was no obvious interaction between the 2 people, just as we've seen in the Bondi Junction Mall, that actually some of these interactions seem to have been very fleeting between people that has caused transmission to occur.
Mark.
For either or both of you, if we had to move up the alert levels, are you confident that level 3 would be able to contain the Delta variant? Asking because in August the effective reproduction number was pushed down to 0.7, but it would probably be about 1.5 for the Delta variant, even under level 3 conditions.
Look, the government hasn't, the Cabinet has not reviewed the alert level systems, and we learn more about new variants all of the time, and we do consider that. We do consider whether changes will be required. At this point, it would be very, very speculative to be talking about alert level 2. At this point, I remind everybody we don't have any new cases here in New Zealand at this point. We're moving to alert level 2 as a precaution to ensure that we don't see spread in the community before we have a chance to do that testing and contact tracing, which is what our system is built around.
Is Capitol Restaurant a location of interest?
Not as far as I know. We've
not on the list, but they ate there.
Right, let me just check that. It should be all the places of interest now should be on the Ministry's website. Yep. Again, each location of interest is assessed by our team to see if there's an exposure risk to others, and sometimes we have places where there's no public exposure risk, where the people there are known, and then that doesn't become a public location of interest.
Hasn't been told to isolate or anything.
We can follow that up. If you've got information, that would be helpful.
Yeah. Amelia.
Are you confident in the current level of testing in border workers?
Yes.
250 MIQ workers are overdue for a test, and some 900 outside MIQ are overdue for a test.
So there's systems in place actively following up those test results, people who are overdue. Sometimes the overdue tests can be relatively a short period of time. I guess the one caution I would add, though, is that testing is happening in the Waikato region as required, and all of the reports I've had is that testing is happening as required, but it is the IT issues are skewing the statistics at the moment.
Those numbers are outside of that, though.
Sorry, I'm happy to come back to you with a further breakdown on that.
I was at a central Wellington testing station today, and there was a Fulton Hogan worker and a parking warden in the queue going up to windows asking if people had a booking for a test, presumably because they'd run out of health staff to do that. Is that acceptable?
Look, ultimately though, look, I'd have to look into that before I could give a proper comment on that.
Wellington wasn't prepared for a surge in testing.
Yeah, can I just comment on that? So we talked to our colleagues last evening, and they've been from this morning putting in place additional capacity. It's much more helpful to have our testers, our nursing and healthcare staff doing the actual testing. We'll often, but what we have talked to DHBs and what they have put in place is using people to help with pastoral care, communicating with people while they're waiting in the line. I don't know exactly who they might be using there in the Wellington testing centre today, but I'm sure it's appropriate. And the important thing is that people are able to be tested by the nursing staff.
Okay, we'll be very, very quick.
On the partner of the positive case, whether they're positive or anything else about them?
No update on that, but obviously they'll have been tested.
Okay, now the flashing lights mean that the bells for Parliament are ringing. So very, very quickly. Jessica?
Cases of those close contacts out of that 4, will we get those back tomorrow, or will we just, as soon as you hear, will you let us know that they're
today? We'll give an update later today on that, and the whole genome sequencing findings as well.
The very last one.
Did you advise the Minister before the pause last night that it should be paused earlier at all?
The first time my advice to the Minister was to do a pause was last evening. I spoke with him, and we discussed it. I also discussed it with Brooke Barrington, who chairs the National Response Leadership Team. It was an on-balance call, and again, this was before we knew about the case coming here, but we decided on balance because we were concerned about these 2 cases, particularly the primary school-aged child who didn't seem to have a direct connection, that at that point in time, our advice was to move to a pause.
Just given the number of locations of interest and the Delta variant that's likely at play here, how nervous are you currently about Wellington?
I'm confident that if we do all the things we have done in the past, and if people do what is asked of them, we will reduce the risk. And so I'd ask Wellingtonians to do that. Whether it's the Delta variant or any other variant, our actions are the same. The R value for the Delta variant is higher, but we also knew that of the Beta variant, which was the variant first identified in the UK, and in fact our response was the same and it has been effective, and I'm fully expecting that will happen here too.
All right, we'll have to wrap it up there. Thanks everybody.